I mean, what the doctor is doing is part of sensitization, it's part of drawing government attention to say, look, the condition at which we are working is not good. You understand what I'm saying? These things are things that make up a quality healthcare delivery. If a doctor is hungry, if I tell you I've not eaten for like 3, 4, 5 days, and I want to operate on you, will you let me? Will I reason well? The doctor didn't swear an oath to be hungry. He swore an oath to take care of patient, you know. So let's assume because I swore an oath and I want to do operation on you and the knife is not there to cut. Do you understand? Spirit is not there. I should go ahead. That is even also desecrating the oath. That is also not following the oath because you are swearing an oath to take care of a patient with all conditions provided. You understand what I'm saying? So I don't think we'll say heartless. It's more of government. Because each day we're talking now, people are dying. And all they need to do is to fulfill this agreement. And even up till now, UK doesn't have enough doctors. That's why they're taking our people. US do not have enough doctors. That's why they're taking our people. Same thing with Saudi Arabia. Instead of us to do things to hold our people that we have trained so well. It's just unfortunate.
Following the several backs and forth between the federal government and health sector in Nigeria, resulting in the current strike action by resident doctors, it has become imperative for the government to meet their demands. While some Nigerians sympathize with the doctors, others have argued and accused them of being greedy with their demands, adding that they are supposed to be considerate as they have all sworn an oath to care for their patients. The strike action by the National Association of Resident Doctors mean Nigerians who are in critical condition cannot receive medical attention. But judging from the side of these doctors, who also have several expectations and responsibilities, they have insisted that their demands have to be met, stating that it is their fundamental human right. Recall that the NARD commenced its strike in the first week of August 2021 over poor remuneration and condition of service. The association's demand for negotiation over irregular payment of salaries, among other issues, have repeatedly been ignored. Hence, the large number of doctors that showed up for the Saudi Arabian government recruitment exercise at Sheraton Hotel in Abuja a few weeks ago.
It's very, very legal. I mean, it's their fundamental right, and government agrees with that. And that's why they signed those agreements that are here. You understand? That's why they signed those agreements, and after signing, they renege. So this time around, I mean, you know, they had to take the NAD to industrial court, which is also not good enough. You're on the negotiating table for something that you didn't do right, for something that you didn't implement, and you're not taking them to court. I don't even understand. You're owing me money. I'm demanding my money. You took me to court. It's not acceptable. Do you understand? That is what is going on.
Following the no work, no pay policy implemented on August 2nd, 2021 by the Minister of Health, Osage Ehanire, the Secretary of the Nigerian Medical Association, Philip Ekpe, in an exclusive interview with Roots TV, questioned the government's decision, stating that the doctors on strike were only fighting for recognized fundamental human rights and as such should not be taken to court.
I'm more interested in the issue of satisfying what NAD has to. The demand of NAD, than the issue of no work, no pay. Because about no pay, no work. They have been working, they were not paid. So what happened? I don't know if you can answer that question. I've also told you that why should government take NAD to National Industrial Court? When are the one that is owing NAD? It amounts to intimidation. You understand? It's not right. I mean, somebody demanding what is right, which you have agreed are supposed to pay, and then you refuse to pay it.
The umbrella body for medical doctors in the country, Nigerian Medical Association, with over 44,000 practicing registered members and other affiliates, has given the federal government a 21-day ultimatum to grant the demands of the doctors or it will join the doctors on strike. When asked on what's next should the government refuse to meet up with their demands, Ekpe said,
I'm telling you that nothing less than 50 per day in different parts of this country will die. So times 50 each day by 10. You understand? That is 50. Yeah, that is 500, right? Yeah. Times by another 10. That's another 500. That is 1,000. So 1,000 persons are dying a day. So you are telling me that what happens? So multiply by 21 days. So that is how many? 21,000. So are you telling me that what happens after 21,000 persons have died? That is not fair. We shouldn't even dream of getting there. That is why NMA is pushing hard to see that government meet the demand of NAD in the shortest possible period, maybe in a week's time or so. I pray that we don't get there. But however, if we get there, we have a constitutional provision where emergency delegate meeting is held and decision taken on the way forward. It may be strike action, it may be another ultimatum, it may be, calling off the strike, they've done enough. That's it.
In March 2019, there were speculations that Nigeria, among other countries, has a small number of qualified doctors left in the country following the recruitment exercise which took place in Abuja. Reacting to the statement, the Minister of Labour and Employment, Chris Ngige, had debunked the statement by saying that Nigeria has enough doctors in the country, hence there is no reason to panic about the recruitment exercise. Ekpe categorically stated that
enough doctors. The recommended by WHO is 1:600 doctors. Sorry, one doctor to 600 patients. You know what we have in Nigeria? 1 to 5,000 something. So we need to employ about 50 to 60 more doctors for each doctor. That is, one doctor is doing the work of 60 doctors. That is what it means. It's not possible. And now that the doctors are leaving because the conditions are not good enough, it's not going to be one doctor to 8,000 patients or one doctor to 10,000 patients. So it's going to be difficult, it's going to be tough. So they need to employ more.
The brain drain that qualified Nigerian doctors are seeking greener pastures overseas is a known fact, but there were speculations that this year's recruitment exercise was hindered by the Department of State Services, a claim the secret police denied.
I wasn't there, but DSS also came to refute that is not true, But whatever, happens, the DSS, the police or the security have no right to stop anybody. When you cannot provide job for them, why are you stopping them? A young man finishes medical school, he comes out, finishes housemanship, first of all, has challenge in getting a place for housemanship, which is currently being sorted out because of the central posting. After the NYSC, no place to work. And another country is begging him to pay him times 15 to times 20 what they would have paid him here. What do you expect him to do?
With the several challenges faced by the health sector in Nigeria, Dr. Ekpe advised the government to increase the yearly budget for the health sector and also beef up the security in the country.
One, I told you that they should increase the budget for health. It will get to 8%, 10%, 12%, and close to that 15%. That will bring in a lot of funds into the health industry. Government should also beef up the security because that is what is causing brain drain. It's a major cause. Of course, immigration is a normal thing in every profession. Even some people want to come to Nigeria. But when they see security, nobody wants to come to Nigeria, rather we all want to leave. Then they should make sure that the facilities have adequate space, not just space, but equipment to work with.